Can drug-induced lupus turn into idiopathic systemic lupus erythematosus, SLE? Imagine living with a condition that can mimic many other diseases, making it tricky to diagnose and even more complex to understand. Drug-induced lupus is one such condition. It occurs when certain medications trigger symptoms similar to lupus, a chronic autoimmune disease. In drug-induced lupus, the immune system mistakenly targets the body's tissues, leading to inflammation and damage, often affecting the skin, joints, and other organs. Common symptoms include fatigue, joint pain, muscle aches, and sometimes a rash. These symptoms usually develop after taking specific drugs like certain antihypertensives, antibiotics, or anti-seizure medications. The key thing to know is that drug-induced lupus is generally reversible. When the offending medication is stopped, symptoms often improve or completely resolve within a few months. Unlike idiopathic systemic lupus erythematosus, which has no clear cause and can affect many organs persistently, drug-induced lupus tends to be limited and less severe. Now, your question is whether drug-induced lupus can turn into idiopathic SLE. The current scientific understanding indicates that while some people with drug-induced lupus may develop symptoms that resemble systemic lupus erythematosus, it is quite rare for it to fully transform into the idiopathic form. Most cases of drug-induced lupus resolve after discontinuing the medication. However, there are rare instances where individuals might develop persistent symptoms or be diagnosed with idiopathic SLE later on, but this is not common. It's important to remember that the development of idiopathic lupus involves a complex interplay of genetic, hormonal, and environmental factors. The presence of drug-induced lupus does not necessarily mean a person will develop the more severe, long-term form of lupus. Medical professionals usually monitor symptoms carefully and perform thorough testing, including blood tests for autoantibodies like anti-nuclear antibodies, to distinguish between the two. In summary, while there is a small possibility that drug-induced lupus could evolve into idiopathic SLE, it is not a typical progression. Most cases improve once the medication is stopped, and ongoing medical care is essential for proper diagnosis and management. If you suspect you have drug-induced lupus or are experiencing symptoms, it's crucial to consult a healthcare professional. They can provide personalized advice, conduct appropriate tests, and help determine the best course of action for your health.